With the announcement of the COVID-19 pandemic, Three Corners Health Services Society has been supporting our Northern Secwepemc communities' access to testing for COVID-19. The video you're about to watch provides an outline of what this testing process looks like.
So things are changing quickly with COVID-19. I'm sure every day you hear something new. And one of the things that's recently changed is the criteria for testing. It's opened up wide. So we're now able to test people who have symptoms, no matter how mild, that have had those symptoms for 24 hours or longer.
Just urge you, if you have any symptoms, including worsening cough, shortness of breath, or any fever that's increased in the last 2 weeks, please seek out help. We're here to help. Testing can be done in community if your symptoms aren't severe, and we can even help you up at the hospital if you have severe symptoms.
The symptoms for COVID, of course, include fever, chills, cough, shortness of breath, a runny or stuffed up nose, headache, muscle aches, fatigue, loss of appetite, or loss of sense of smell. So if you're experiencing any of these symptoms and are wanting to be tested, please call one of our nurses at Three Corners and talk to them. And as always, any calls or information that's shared with our nurses are kept confidential.
Our Indigenous communities bear a significant burden of chronic illnesses such as diabetes, rheumatoid disease, asthma, and many others. Because of this, exposure to COVID-19 places them at significant risk of serious consequences.
During this stressful time, do not neglect your chronic healthcare conditions like diabetes and hypertension. The hospital's still open. We're here to help. It's a safe place. We are taking all the precautions necessary. And please also do not neglect any mental health or substance use issues.
So if you find that you have symptoms of COVID, what you'll do is there's a number that you can call and they'll give you instructions on whether you need to stay at home, come into the hospital, or come in by ambulance. So if you do come to the hospital, you're going to be greeted by a nurse at the door who's going to ask you some questions about the symptoms that you're having. And then based on that, they can bring you to a little tent where we can do our assessment and find out how we can help you.
So the testing for COVID-19 is relatively simple and fast. The nurses will have you blow your nose to clear out your sinuses. Then she will position you with your head tilted slightly back. Then she will take the swab and insert it into one of your nostrils until it reaches the back of your pharynx, which we all know is the back of our throat. She will then take that swab will then be rotated in your nose for about 10 to 20 seconds to get a really good sample. Then she'll remove the swab. The whole thing should take less than a minute. So once your sample is taken, the nurse will take it to the lab and it'll be sent to the BC CDC lab down in Vancouver for testing. And the results should be available within 3 to 5 days, depending on if you fall on a weekend. So after 3 days or 72 hours, you can call the COVID negative results line, 8:30 to 4:30, 7 days a week. There's someone answering that phone. If, on the other hand, your results are positive, you'll receive a call from the public health nurse at Interior Health.
Corinne, bailiff, and I are set up in our communities to start doing testing, so please don't hesitate to reach out to us. We have the support from Patrice Gordon, our nurse practitioner. We are here Monday to Friday to do phone appointments, to discuss any concerns you might be having, or to go through symptoms that you may be experiencing.
If you have any COVID-19 questions or feel that you need to be tested, please call the screening numbers. There's one for Williams Lake and one for 100 Mile.
The hospital is a safe place. You don't have to avoid it, but do keep your visits for emergencies only.
We've prepared additional space for assessment and treatment. If you have any condition that you would normally seek help for at the emergency department, please still do.
Staying informed, supported, and having access to care. This is the only way we can flatten the curve and protect our communities.
So if you have any questions about getting tested or the procedure, please call one of the nurses at Three Corners Health. We're here Monday to Friday, 8:30 to 4:30. We can be reached Saturday and Sunday as well as holidays, 12 p.m. to 4 p.m.
If you have any symptoms, even the mildest of cold or flu-like symptoms, we want to hear from you. We will assess, monitor, and even test. We're here to address COVID-19 symptoms and all your primary health care concerns.
If you have any questions after watching our video, please call us at Three Corners Health Services Society. Cook